He's my dog. And I'm mighty lucky he's my dog.
This morning on Today's Pets, dealing with serious illness. Last winter, Today entertainment correspondent Jill Rappaport's German Shepherd Jack was diagnosed with bone cancer, and we followed him through his treatment and learned about the remarkable level of specialty care available to animals today. Here's a look back at Jack's ordeal.
I don't have children, and these are my children. You know, those wagging tails, I'm in love with my animals.
Like millions of American pet owners, Jill feels her animals are her family.
Yeah.
So when her 11-and-a-half-year-old German Shepherd Jack was diagnosed with cancer, she sought the best care possible.
Specialty medicine has evolved, just like in human medicine, to give pets the very best care.
Among the specialties increasingly available, cancer treatment for your pet.
There's been an explosion in knowledge over the past, 5 to 10 years. The diagnosis of cancer is no longer a death sentence. I really thought that Jack could handle both the surgery as well as the chemotherapy.
And he did.
See how good he looks? He's like, oh, I know where I'm at. It's okay, bud.
After having his leg amputated, Jack underwent 6 rounds of chemotherapy, and we were there last March on Jack's last day of treatment.
I think at this point, Jack could not be doing any better.
Look how much faster he goes out of here than he comes in. He's like, bye-bye. This is my idea of total bliss. To be in my home, surrounded by my babies. I would go to any length and any expense to extend their life, to save their life, as long as they're not in pain.
Well, that was back in March. Jill Rappaport and Jack are here with veterinarian oncologist Dr. Gerald Post. Nice to have you here.
Hello.
How's Jack doing? I guess this was 14 months ago that he had the surgery, and then he had his last chemo treatment 7 months ago, Jill?
Yes, actually, a year ago he had the surgery, but he was first diagnosed with the cancer 14 months, and knock on wood, I found the leg down here. 14 months later, he is cancer-free, and it is truly a miracle that he's sitting here doing great. He's a little nervous now.
Yeah,
all the lights, he thought he was going back into surgery.
You can see he's such a happy dog, and he looks so healthy. His eyes, everything. Yeah. Dr. Post, this is it's becoming a real huge field in veterinary medicine. It's the specialty care in animals.
Absolutely.
Why do you think that is? Why are people choosing to give their animals this, the ability to live longer, given usually a disease that kills them?
Sure. I think pets are becoming part of people's family, and people are continuing to look for the same type of treatment that they receive themselves and that they would choose for members of their family.
How widespread is cancer in animals?
It's unfortunately very widespread. According to some new statistics, 6 million dogs and 6 million cats may be diagnosed every year.
We want to give some information out there to those who may be wondering if their pet is sick and may have cancer. And there's some symptoms you say they should be looking for. Sure. Beginning with swollen lymph nodes, enlarging or changing lumps, abdominal distension, chronic weight loss, chronic vomiting or diarrhea, unexplained bleeding, cough, lameness, straining to urinate, or an oral odor.
All of these are signs that may be due to other things, but if any of these signs occur, you should seek, your local veterinarian and then potentially a referral to a board-certified veterinary specialist if the problem warrants it.
And the same way as with people, you say it's important to know your options, right? Know that there are ways to treat animals. It doesn't have to be a death sentence.
Absolutely, and I couldn't put it better myself. And there are really 2 pillars that we try and achieve in veterinary oncology, and that is not only quantity of life, but also quality of life. We want our pets, while they're alive and while they're going through cancer therapy and afterwards, to have a great quality of life.
I imagine cost is something that is probably preventative for a lot of people to be able to afford to do something.
Yes and no. I mean, at both of our clinics in Norwalk and in Westbury, we have the philosophy that we want to offer people the best cancer care that they can afford, and either emotionally or financially afford, and we will work with them to make sure that that happens.
Right. We talked about quality of life, which to me, Natalie, was the most important thing for this dog. We're talking about now he's 12-and-a-half years old, and a big dog, and I just want to tell people, who, if they have this devastating diagnosis, Jack is doing great on 3 legs. I mean, literally,
we saw him running out of the veterinary clinic.
He dug up my lawn, and I was thrilled. And, just about 3 weeks ago, I turned my back for 1 minute, and he was off chasing a deer. We found him a half a mile away. We had a whole posse looking for him, and we had to carry him home. He was so tired, but he has a great